Good afternoon. I'm mindful that I am standing between you and the end of your day, and I know that you all have heard a lot today, so I'll try to keep my comments both brief and relevant. I appreciate Stacy pointing out that I am here today in my official capacity working for the governor. I do not speak for the campaign, but I think that we do know that good government is good politics, and that there's probably some inevitable overlap as we talk about what's up for the future, what's our next term look like, what's our vision for the future. So I will touch on some of those items, but want to make it clear that if there's political questions, then I'll need to refer those to the campaign. When the federal health care reform bill passed, it was obviously late at night, you all know, and the next morning I was in a meeting with the lieutenant governor. And I don't talk very often about what happens in those kinds of meetings because I really think that that's private and it's incumbent on me to keep those things private. But I will say that the lieutenant governor walked in and we were talking, and at one point she literally pounded on the table and she's like, I am just so damn proud, excuse my language, that this bill finally passed. And that really has set the tone for how our administration, how the governor's administration is working to implement federal health care reform. I think it's important to know what we have done over the last 3.5 years working in partnership with our friends in the legislature to set the stage for Iowa to successfully implement the federal health care reform. I'm going to go through a couple of points here. The Kaiser Family Foundation found that Iowa has the third lowest percentage of uninsured citizens. Just that fact alone means we don't have as much ground to cover as a lot of other states do. We working with our friends in the legislature, 1 year passed a $1 increase in the state's tobacco tax and then the Smoke-Free Air Act. Because of that, smoking rates have dropped by 52% in the state of Iowa. It's the last information I saw, Iowa has the second lowest smoking rate in the country. I think Utah has the lowest. I don't know that we'll ever catch them. We can try. We've approved the expansion of the state's Iowa Care program. One of the earlier speakers talked about how Iowa doesn't have a program for childless adults. I take issue with that. We do. The Iowa Care program is a limited benefit that provides services here at the University of Iowa. Stacy and I could probably tell you some really boring stories about getting that bill off the ground, both of us in different jobs, and at Broadlawns in Polk County. The expansion that will go into place this year puts in place a network through the federally qualified health centers to begin a medical home for Iowa Care recipients. There's some really exciting work that's being done on that. We worked with our partners in the legislature to repeal Iowa's restrictive stem cell ban and then secured $30 million of funding for the Institute for Biomedical Discovery here at the University of Iowa. Also, we have done a lot of work in the area of family planning, making family planning services available to low and moderate income Iowans. Taken with that, we've expanded coverage for pregnant women up to 300% of the federal poverty level. So if you're pregnant and you're up to 300%, we can pay for a healthy pregnancy, a healthy delivery, hopefully a healthy child. Since taking office, the governor and lieutenant governor have extended health care coverage to 57,000 Iowa children. 57,000 Iowa children. Maybe the point in all of this that the governor and lieutenant governor are most proud of in their administration. They've also passed 12-month continuous eligibility. Why is that important? Well, if you receive a Medicaid benefit prior to the passage of 12-month continuous eligibility, if your family income varied or if it changed, bill passed, Iowa extended eligibility for children up to the age of 25, not 26, for insurance coverage, fully 2 years before the federal government was able to get that passed. That's really something to be proud of. We've advocated for the Healthy Kids Act, which removes junk food from schools and increases physical exercise in schools, and created the Governor's Council on Physical Fitness and Nutrition. As we look towards the future, if we look at implementation of the federal health care reform, the governor and lieutenant governor made the decision that they were going to have Iowa administer the state's high-risk pool. You were given a choice whether or not you wanted the state to administer that program or whether you wanted to turn it to the federal government. Iowa's going to administer that program. Susan's been working hard with HHS to get that up really quickly. As it's been said here several times today, there's $35 million available to the state of Iowa to provide coverage to people who who have a pre-existing condition that has kept them from getting coverage in the past. That will mean about 1,000 Iowans is what we're estimating with that $35 million. But that's something that's really, really important to the people who have been without coverage, who probably, because they have a pre-existing condition, either are not undergoing care or are paying quite a lot out of their pocket to receive care for that condition. It also hopefully will bring down uncompensated care rates. We also will work with our federal partners if that $35 million, if it looks like it's not going to be enough. We've heard a lot of the discussion, will the $35 million be enough? I was just at a National Governors Association conference 2 weeks ago, and it's pretty clear to me that the federal government is going to be looking for ways to extend that bridge to 2014 when the act is fully up and running. Another priority of the governor and lieutenant governors that has been communicated to our department directors, who we gather together to go forward on healthcare reform, is that this whole process looks seamless to the consumer. That between the exchange and Medicaid and Iowa Care and whatever other program is going on, that the consumer and the provider will have one stop to get the answers that they need to help them navigate this process. And so everything that we're doing right now to get this program ready to go is oriented in that direction. Some of the things that we're talking about, the governor last week toured Genesis Health Systems in Davenport, and there announced that he's going to ask the legislature to reinstate the provider rate reductions that were put into place as part of the across-the-board reductions. That's not something that we're able to do administratively, but that will go, we'll be asking the legislature to look to fund those when they reconvene in January. We're also expressing our support for expanded mental health parity. Right now in Iowa, there's a very limited set of diagnoses that are covered under the mental health parity law. Some of the notable things that are left out of it are children's diagnoses and substance use disorders. So we're going to be asking the legislature to carefully consider an expanded mental health parity. It's the governor's belief that if you're receiving treatment for your actual diagnoses, that will bring down healthcare costs. There's an OMB study when they went to what's called full boat parity in the federal benefit plan, that it actually reduced costs. I know there's fear that it'll raise cost mandates, but it is something worth considering. One of the things that we're looking at as part of the federal healthcare reform bill that has been discussed today is the fact that approximately 100,000 new people will be in the Medicaid program. It's not enough just to provide somebody with a Medicaid card. We also have to make sure that they have access to services once they have that benefit. So we know that, and I'm not telling you, look at all my friends in this room, anything you don't know, that we have a shortage of healthcare providers in the state, particularly mental health, particularly dental health, direct care. So we will be working with our Department of Public Health and Human Services to ensure that we have the infrastructure in place to meet the needs of the federal healthcare reform. That infrastructure also includes health information technology. I've heard the governor say way too many times that we wants to be the best connected state in the country. That extends obviously to healthcare with telehealth and electronic health records and all the things that we're doing to be poised to really, really put that into place. Let me look at my notes and make sure I'm not leaving anything out. Oh, the last one, wellness and prevention. One of the things the governor has articulated to me as a priority going into the next legislative session and into his next term is that we will lead the nation on preventive screenings, things like mammography, colonoscopy, but that also that we do screenings in anticipation prior to someone being diagnosed with a chronic disease, that we have those early interventions. With the work that's being done on medical home, it looks like we will really be well positioned to accomplish those things. So I thank you all for your time. I see that I wrapped it up in only 10 minutes, so maybe I should give my extra 5 minutes to Senator Hatch, huh? Thank you.